Welcome to Whiteboard Learning app. I'm Dr. Suchitra, and in this session, I'm going to discuss in detail about the official compounds of iron, iodine and then calcium. So coming to the first one, the official compounds of iron. So first of all, what is this iron and what is the main role of its iron? So, iron is considered as the essential trace element. It is one of the essential trace element of our body. Essential trace element of our body. Important essential trace element of our body, and it mainly our total body contains about 3 to 4 mg of 3 to 4 grams of iron. Our total body consists of 3 to 4 grams of iron, and out of this 70% occurs in 70% of this iron occurs in hemoglobin and myoglobin. It occurs in hemoglobin and myoglobin, and the remaining 30% occurs as transport protein. It occurs as transport protein, enzyme iron, and then as storage iron. Okay, so it is one of the essential trace element, and the total body content means the total iron body content of iron is 3 to 4 grams. And out of that, 70% will be present in hemoglobin and myoglobin, and the remaining 30% is present as, or it occurs as, enzyme iron, transport iron or storage iron. And coming to the daily requirement. So, what is the daily requirement of this? So, in general, the daily requirement of iron is very less because our body has a capability to recycle the iron. To recycle the iron. See, whatever it is obtained from the degradation of RBC. So, the RBC undergoes degradation and finally it is going to give the hemoglobin. So, that hemoglobin will be recycled and it is utilized by our body. Therefore, the daily requirement of iron will be very low. So, in case of males, so the daily requirement of this iron in an average adult male is 10 to 12 mg. Whereas in a female, it is about 12 to 18 mg. And this requirement increases in those who are in growing children, like in case of growing children and for pregnant women and lactating mother. Pregnant woman and lactating mother requires more amount of this iron, because if you take an example of pregnant woman, so in case of pregnant woman, here what happens? So about 300 mg more than that of the required. See, 300 mg of iron is required for fetus development, and the about 400 to 500 mg of iron is required for increased maternal red blood cells. So, for that sake, in case of our growing children as well as for pregnant women and for lactating mothers require more amount of iron than that of the recommended values. So, coming to the role, what is the biochemical functions of this one, or biochemical role of iron? So, biochemical function or biochemical role of our iron. So, here iron plays a very important role in the synthesis of hemoglobin for RBC and then for synthesis of myoglobin. That is the first thing. First one is for the synthesis of hemoglobin, and second one is for the synthesis of myoglobin. So, which myoglobin, what it will do? It will provide an oxygen. It provides oxygen to the muscles, skeletal and cardiac muscles, skeletal and cardiac muscles. And apart from this iron also has other applications, major important functions, that is, it acts as a cofactor for many enzymes. Cofactor for many enzymes. For example, if you take cytochrome oxidase. For example, take an cytochrome oxidase. So, this cytochrome oxidase, it plays an important role in oxidative phosphorylation and electron transport chain. So, which plays an important role in oxidative phosphorylation and electron transport chain. And the second enzyme is our cytochrome P450, which is majorly responsible for liver detoxification. That is cytochrome P450. So, which is responsible for liver detoxification. Responsible for liver detoxification. And it also acts as a cofactor for other enzymes like those enzymes which are involved in the Krebs cycle. So, Krebs cycle enzymes, which is required for energy production. Which is required for energy production. Right. And other enzymes includes peroxidase. So, which is a lysozymal enzyme. Peroxidase. So, which is a lysozymal enzyme which required for phagocytosis, for killing of the bacteria. Phagocytosis. So, these are the functions of these are the various enzymes for which it is acting as a cofactor. And the other functions apart from this, it also acts, it also has other functions like it mainly responsible it plays an important role in the normal development and brain development also. Plays an important role in brain development and then normal growth. For brain development and normal growth. Normal growth of a body. And it is also an important constituent of chromatin in the nucleus. So, it is an important constituent of chromatin. Therefore, it plays an important role in nucleus formation. Okay, so these are the some of the biochemical functions or role of our iron. First one is for the synthesis of hemoglobin, for the synthesis of myoglobin, and it acts as a cofactor for many enzymes like cytochrome C oxidase, cytochrome P450, Krebs cycle enzymes, and next peroxidase enzyme. And apart from that, it is also helps in brain development as well as for normal growth of a person. And it also a important constituent of chromatin nucleus, chromatin in the nucleus. Therefore, it helps in the normal functioning of the nucleus. So, these are the major functions of this iron. And next, coming to the deficiency of iron. So, what happens if any deficiency occurs? So, generally, deficiency of iron leads to anemia. It leads to anemia. So, here, especially the pregnant women, lactating mothers, and those who are having intestinal parasites like hookworms and who are suffering with malaria are more prone to this anemic conditions. And whoever having these anemic conditions, they will be more susceptible to the infections, bacterial infections, means their immunity power gets reduced. So, here lactating mother. So, especially lactating mother, pregnant woman, and who are in adolescent, means adolescent girls also will be affected with this ammonia due to their heavy menstruation due to some conditions. and other due to intestinal parasites. Yes, here intestinal parasites like hookworms. So what they'll do, they prevent the absorption of iron from the intestine. So as they prevent the absorption of iron from the intestine, then it leads to deficiency of iron, finally leads to anemic condition. So these are more prone to this, more prone to anemia. So parasites as well as who are suffering with malaria. Okay, right. So these are the deficiency of this anemia leads to. Sometimes the overdose of this iron also occurs. And coming to the overdosage, so what happens if the overdosage occurs? So overdose of this iron leads to toxicity. It leads to toxicity. And this toxicity can be overcome or it can be removed by taking some measures like by gastric lavage. So what is the remedy for this? So first we can go for gastric lavage, and then which is followed by, after gastric lavage, we should give either sodium bicarbonate or sodium dihydrogen phosphate. Sodium dihydrogen phosphate. So it is considered as antidotes for this poisoning. Okay, right. And sometimes in patients who are not having any renal insufficiency, means who are not having any kidney disorders, so in those persons, we can give deferoxamine. So deferoxamine. So this is very, very important, and in the previous questions also they have asked this question. So deferoxamine is used for treating the iron poisoning. So deferoxamine, so what it will do, this deferoxamine, it prevents the absorption of iron from our stomach. So finally that will be eliminated through urine. So prevents absorption and got eliminated from through urine, and gets eliminated through urine. Right. Eliminated through urine. Okay. Right. So this is very, very important. Deferoxamine. Deferoxamine is very, very important. Right. So, so how to overcome this deficiency? So this deficiency problems can be overcome by using various iron preparations or iron official compounds. So these iron preparations are available in the various dosage forms are available in the market, like oral liquids. So these are available in the form of oral liquids, so which includes syrup, suspensions, and then tablet forms, and next capsules, and also injectables. Okay, so but these injectables are not widely used because this oral, whatever we are taking through oral only, they are having satisfactory results in comparison to that of these injectables. And even this oral route, whatever we are taking these preparations, that preparations also got some side effects like gastrointestinal, like constipation and gastrointestinal disturbances, GIT disturbances, and which leads to nausea and vomiting. But these can be overcome. Nausea and vomiting. So these side effects can be overcome by changing the dose and administration time, by controlling the dose and administration time. So this is about deficiency and its overdoses. So deficiency leads to anemia, and this especially lactating mothers, pregnant women and adolescent women and intestinal, those patients who are suffering with intestinal parasites like hookworms and who are suffering from malaria are more prone to this deficiency, more prone to anemia. Coming to the overdose, it leads to toxicity. So generally we need to give the we need to go for gastric lavage, and after that should be followed by sodium bicarbonate or else sodium dihydrogen phosphate. And in patients who are not having any kidney disorders, then at that time we can go for this deferoxamine, which prevents the absorption from the stomach and gets eliminated through urine. And oral, these are so what is the remedy? So these can be treated by using various iron preparations. So those iron preparations includes means various dosage forms are available in the market, like liquids or oral liquids and tablets, capsules, injectables. Also injectables does not have more satisfactory results than that of the tablets, but these tablets also has some side effect. It does not have any side effect. It has side effect that it is having a problem of constipation and some GI tract disturbances which leads to nausea and vomiting, but that can be controlled by dose and administration of that iron preparation. And iron preparations, generally this iron will be in two forms, that is one in ferrous form and other is ferric form. So it occurs in ferrous form and ferric form. It occurs as ferrous form and ferric form. So this ferrous form is more soluble and it gives the best results, means it will be readily absorbed and it gives the best results in comparison to that of the ferric form. Therefore, most of these preparations contains ferrous form of this iron. So coming to the preparations, official compounds of this iron. So few of the compounds we have to read in detail. So these are the few compounds. So coming to the first one, that is iron and ammonium citrate. So it is also known as ferric ammonium citrate. So this is a chemical formula. And coming to the assay method. So what is this assay method? Assay is nothing but determination of percentage purity of that particular compound. So here the assay or the percentage purity of that compound can be determined by iodometric titration method. It is determined by iodometric titration method. And in the previous classes also I have given you just an information regarding the types of titration. So generally the four types of titrations are there. Titrations are of four types. So one is acid-base titrations, and under acid-base titrations again there will be two types, aqueous acid-base titrations and non-aqueous acid-base titrations. And under aqueous and non-aqueous acid-base titrations again there will be two types. So one is acidimetric titrations and another one is alkalimetric titrations. And the second type of titrations is redox titrations. Redox titrations. So under redox titrations again based upon the type of oxidizing agent used, these are further classified into permanganometric titrations, okay. And next, so in this potassium permanganate is used as a titrant. So and second one is dichromate titrations. Dichromate titrations in which potassium dichromate is used as an oxidizing agent and as a titrant. And third one is iodometric titration, means iodine titrations. So in these iodine titrations again there will be two types. So one is iodometric titrations and other one is iodimetric. Iodometric and other one is iodimetric. So in case of iodimetric titrations, iodine is taken as a titrant. Means in titrimetric, in any titrations generally we will be using a titrant and a titrant. Titrant is nothing but which we have taken in the burette, which is of standard solution, and titrand is nothing but which is taken in our conical flask. And then by adding a suitable indicator, we will be identifying the end point of that particular titration. Okay, and thereby we can determine the exact quantity of the particular compound. So in case of iodimetry, iodimetry is nothing but we are taking iodine in the burette, means that is considered as a titrant. Whereas in case of iodometric method, so in this what we'll do, simply we'll take the sample. To that sample we'll be adding potassium iodide, and then we'll make that solution acidic in nature. Then we'll keep that in the dark, means everything will be taken in iodine flask, and that should be kept in the dark for few minutes. So after few minutes, just take that one, add some starch solution. So if you add starch solution, what happens? It will develop blue color if iodine has been liberated. So that indicates that iodine has been liberated. So then that whatever the liberated iodine that is present in the conical flask, that should be titrated with sodium thiosulfate solution. Okay, so this is an indirect, like it will be an indirect titration. So liberated iodine is titrating with other one, whereas in iodimetry we are directly titrating with the iodine, standard iodine. And other titration, redox titration is our serimetry titration. So serimetry titration, so in which seric ammonium sulfate is used as a titrant, and the seric ammonium sulfate, so what it will do, generally it itself acts as a self indicator, but in order to get an accurate endpoint, sometimes we will be using ferroin sulfate as an indicator. And the next titration is bromatometric titration. So in this bromatometric titration, so in this bromatometric titration, potassium bromate, that is KBrO3, is used as a potassium bromate is used as a oxidizing agent, nothing but a titrant. And this potassium iodate, in some titration this KiO3, potassium iodate is used as a this oxidizing, what will say, our titrant. So depending upon the type of oxidizing agent used, these are classified into following types. And in the present means for the assay of these calcium compounds, so in the first one, that is ferric ammonium citrate, the assay method is done by iodometric titration method. So in this, the liberated iodine is titrated with that of the sodium thiosulfate. Sodium thiosulfate is used as a titrant here, and the starch is used as a indicator. Right. So so acid-base titrations, redox titrations, and these all comes under redox titrations. And apart from this, there will be two more types of titrations. So one is complexometric titrations, and other one is precipitation titrations. Okay, so coming to the uses of this ferric ammonium citrate. So it is used for treating anemia. Okay, right. Coming to the advantages. So what is the side effect of this oral preparations? Already have told you, constipation as well as nausea and vomiting is considered as a side effects of this oral preparation. So, but in comparison to other preparations, other iron preparations, it has less constipation and less irritant action. It does not have any gastric irritation action. Therefore, it can be safely used. And coming to the right. So, second one is ferrous fumarate. This ferrous fumarate, it is assayed by serimetric method. Just now I told you serimetric method. In this, seric ammonium sulfate is used as a titrant. So, generally this seric ammonium sulfate itself acts as a indicator, self-indicator, like our potassium permanganate. But sometimes in order to have an accurate endpoint, we'll go for the other indicator, that is ferroin sulfate. And coming to the uses, so it is used as hematinic. So what is hematinic? Hematinics are those compounds which produces the blood, which helps in production of the blood, that is RBC. So, and these are used in the form of tablets, means these are meant for oral only. And coming to the third one, ferrous gluconate. So this ferrous gluconate, it is also assayed by serimetric titration method. And wherever the serimetry comes, you have to go for blindly that seric ammonium sulfate is used as a titrant. So here seric ammonium sulfate is used as a titrant, and the indicator is none other than our ferroin sulfate. Coming to the applications or uses. So it is also used as hematinic, And coming to the advantages of this one, it has less side effects, like whatever the constipation effect and gastric irritation, it is having less effects than that of the ferrous sulfate. And it is used for preparation of ferrous gluconate tablets. Obviously, it is used for oral preparations, preparing the oral preparation. And next, coming to the other compound, that is our ferrous succinate. Ferrous succinate, so it is assayed by same serimetric titration method, and the titrant used is ceric ammonium sulfate, and indicator is ferroin sulfate, and uses hematinic. Okay, so next one is ferrous sulfate. So this is very, very important. And this ferrous sulfate, it is determined by two methods. So here we have employed two methods. One is permanganometric titration method. So wherever the permanganometric titration comes, you should remember that potassium permanganate is used as a titrant or standard. So here potassium permanganate is used as a standard, and it does not require any indicator because potassium permanganate itself acts as a self-indicator. And second method is our serimetric method. So in the serimetric method, ceric ammonium sulfate is used as a titrant and our indicator is ferroin sulfate. Right. So it is also used as an hematinic, and it is given in the form of tablets and capsules. So next one is iron and dextran injection. Right. So iron and dextran injection. So it is a sterile. It is a sterile complex, colloidal complex formed by complexation of ferric ion with our dextran, a low molecular weight dextran compounds. Okay, and this can be used either intravenously or intramuscularly. And and those patients who are unable to take, see, already have told you that generally this iron preparation should be consumed orally only. Parenterally it does not give any satisfactory results. Okay, so but those patients who are unable to take orally, in those persons we can go for either IV injections or intramuscular injection. So this can be used safely, but dextran, it has some irritation effect. And coming to the assay methods. So right, take one more also here, iron sorbitol injection, which is given intramuscularly. So iron sorbitol injection, so it is also a sterile colloidal injection, which is a complex of ferric ion, sorbitol plus citric acid. It is a complex of all these three one. So generally the citric acid, so iron preparations, so these iron preparations contains generally our cyanocobalamin. So what is cyanocobalamin? Cobalamin. So this is nothing but our vitamin B12. It is vitamin B12. So this vitamin B12, it is required for normal functioning of our brain and nerve cells. So and also helps in production of RBC. Therefore, these iron preparations are given along with that of the cyanocobalamin. And not only that one, it is also given along with that of the citric acid, which helps in which enhances or increases the absorption of this iron. So therefore, it has to be given in combination with this. So here, this iron sorbitol injection also contains ferric ion, sorbitol and this citric acid. And this ferric ions, so these ferric ions generally have low solubility. Therefore, what we'll do immediately, with this gets converted into, this gets reduces to ferrous form. Okay. Coming to the assay method. So assay method, it is assayed by serimetric method, same methods. And the next titrant is ceric ammonium sulfate, and the indicator used is ferroin sulfate. And this is used for especially for treating anemia who are not able to take the oral preparations. Right. Coming to the other preparations. Right. So these are the few iron preparations. So what are those? So ferric ammonium citrate, ferrous fumarate, ferrous gluconate, and ferrous succinate, ferrous sulfate, and iron and dextran injection, and iron sorbitol injection.